I personally wouldn't trust a doctor to make the ethical decisions for anyone in my family. I know, unfortunately, a lot of times the doctors will think that they know what's best from an ethical standpoint, which I don't really know how they can know that, but they will try to impose that upon families and try to impose that upon patients, and you have to be very careful these days. When I was rotating at MD Anderson, then we did actually have someone from the ethics committee come and talk to the residents to sort of teach us about ethics. And I can't remember what kind of case it was. It was probably an end of life case. And he sort of talked about how the ethics committee would evaluate it from a moral standpoint. And I knew that from the training that I have had, that that was probably not the way that I would have evaluated that case. And then after the discussion, he sort of was mentioning different things, and it turns out that he is pro-choice. So it's hard really to trust any of his judgments. And he was a member of the ethics committee. Well, the End of Life Conference, I attended a Texas Right to Life End of Life Conference about 2 years ago. And of course, we talked about end of life issues. And I thought that I really understood end of life problems, but really I didn't until I attended that conference. So it was a really great way for me to learn more about how to evaluate from a moral standpoint patients and end of life issues. I can just tell you, since I'm on the ethics committee at our hospital, they didn't ask me if I'd had any training in ethics or any particular qualifications to put me on the ethics committee. The reason I'm on the ethics committee is because they had a piece of paper where they said, "Are you interested in joining any of the committees at the hospital?" And I checked off ethics. And they said, okay. So basically, anyone could be on the ethics committee, regardless of qualifications or viewpoints. I think there is definitely a feeling among the medical community that a person um, sort of has a limited amount of resources that should be allocated to them. And then after they use up that amount of resources, really they're just a burden on the system and they need to be out of the system one way or the other. And so there is sort of this almost eugenic, I think, mentality among a lot of medical professionals.
I have one more question um, before we wrap it up.
Let me at least turn it off. Oh, that's Elizabeth Grant. You're interrupting us, Elizabeth. No, I'm sitting down for an interview with Rachel and Patty. Mm-hmm. So is she a patient in the hospital right now? So she's there in a room. Yeah. I don't think anyone's going to be able to do anything. So, yeah, that's all right. Yeah, we'll say a prayer. What else said?
So what was that about?
Oh, it's just a family that there's a lady who's 20 weeks pregnant who's in labor, and she won't. And at the hospital, they said that they won't do anything to try to resuscitate the baby, but supporting Texas Right to Life doesn't mean just supporting pro-life candidates or trying to support pro-life bills going through the legislature. It supports also pro-life education of not only college students but medical students, and really it's also supporting patients' rights, because if a family comes into a situation where they don't agree with the ethical decisions made by the physicians, they rely upon Texas Right to Life to go to bat for them, and even legally if necessary. So really patients' rights are depending upon the work of Texas Right to Life also. And any way that we can support Texas Right to Life, we should be doing that.